Hi, I'm Karly Renn. I live in a small town in Texas. I'm 44 years old, and June 2022, I was 42 years old and diagnosed with stage 4 lung cancer with metastasis to my brain. After about 4 weeks after the diagnosis, it was confirmed that I had a EGFR mutation. I started on first line Tagrisso, and for the first year, I everything looked great. The fall of 2023, I had progression to my T12 and my left ninth rib, and did localized radiation to both of those areas. And I started 4 rounds of chemo in November of 2023 through January of 2024. And now I am back on just my daily Tagrisso. I think after, I'm 2 years into this and hopefully many, many more. But I think after I personally got over like the shock and awe of it all and kind of settled and found my support, my next big goal was like, how do I get involved? What can I do? How do I personally, just as one person, one, help people become aware, two, find the research, find the drugs, find the companies that are going to develop these medications, because it is that next medication. That's how close we are. That is going to give me the years that I want. I don't want just, you know, 5 years. I want to see my 4-year-old daughter. I want to see her have a baby. And I think that seems so far-fetched and unrealistic, but I think every clinical trial and every drug that comes and every, patient story that's shared, like we get that much closer to figuring out something and something new, or even if it's just these new drugs that give us this more time, and then we can build on it with this more time. And then I think that that's what excites me, and that's what makes me feel um, called to share my story and to support the people that are in the same position as me, and finding the answers to these questions.
Yeah, I think that's important. I think that's what we're trying to do with the Young Lung Cancer Initiative, is to make it easier for you to advocate, to know how to share your story, to be able to share your story, and really be the vessel to communicate your story and your message to others easily without having to really search out an outlet to do so. Can you kind of explain to me what it was like being diagnosed at 42 years old as a young mom with small children? Like, how did you feel? How did the kids react? How did your husband react?
Um, yes, I'll tell you that when I was diagnosed, there were 5 days that I was in the hospital here in Dallas with my husband Josh, and I will always refer to those 5 days as the darkest days of my entire life. We didn't really have a lot of answers, and all I could think about were my kids. And today I can tell you that the darkness has faded, but all I can think about is my kids. At the time, my youngest was 2, and then my oldest was 11. We initially just shared the news with our 11-year-old son at the time. And it was difficult because he had a faint memory of my father, who unfortunately in 2014 had passed away from a very brief battle with pancreatic cancer, which is extremely aggressive. And so there were lots of conversations that my cancer was different and it wasn't like Papa Eddie's. But I will tell you, even feeling good and going through these treatments, the thought of my kids is what will bring me to almost feel paralyzed by that fear of leaving them. And I don't think that there's anything that can change that, because I think as a mom, you just want to protect your children.
It doesn't ever go away the older they get.
Yeah.
That's just your
And
instinct.
yeah. And I think not so much about, my life being over, because I have a security and assurance in that, but it's just me thinking about my husband, Josh, and him navigating life with 4 children. And this past summer, just a few weeks ago, we went to the beach. It was about our 10th summer to go to the same beach. Love it there. But, the first day I was there, I was with Josh on the beach, and I just was kind of sad and bummed. And I just couldn't help but think, like, what is their first time at the beach without me going to look like? And I know that their lives will go on and they'll be loved, but I just fear this really terrible thing happening in their lives of losing their mom, and I just don't want it to change the possibilities they could have, or the futures or the love they feel.
I totally can understand what you're saying. And mine were, let's see, I was 43 when I was diagnosed, and my kids were 14, 13, and 9. And I can remember I was in the hospital for 8 days with my husband, and my mom was there too. And I can remember this just in my head, keep thinking, this can't be real. I've got kids. My job is not done. Like, they're not old enough. I can't leave now. Like, and it wasn't even about myself. It was more about Todd and the kids. Like, how's he going to do this? He travels with work. There's 3 of them and 1 of him, and he'll have his own grief. And even though, like, I don't necessarily think about that every day anymore, but I do feel that things easily get clouded with this whole heaviness of not wanting to put this burden on anyone, my kids, my parents, my siblings, my friends, my husband. I mean, it's a ripple effect. It's not so, because I feel I'm not scared of death. I just am scared of what happens to the people that we leave behind.
I absolutely get that. Yeah.
It is a hard.
And it's hard to, like I said, I have a really great support, but it's hard to understand that there's certain things that I get scared to, like, personally, like, think about or anticipate or dream about, because I'm so afraid that I'm not going to be here for it. And then if I think too much about that, it just sends me down this rabbit hole of fear, which I try not to live in. But then I think about all the things that are coming, like these clinical trials and these drugs and these treatments that, are, who's to say that I won't be able to see those things happening? And I think I've had to learn to stop thinking about, like, being 80 years old, but thinking about, like, what these wonderful milestone and moments when they come, how grateful I am to be here for them.
Right. Kind of like staying in the moment and not
Yeah,
worrying about the weddings, but enjoying the,
exactly.
recital or the 8th grade graduation or whatever it is. But yeah, I can, it's hard to keep your mind from not, like, jumping ahead. But no, I can totally relate, because even though I'm preparing to send my oldest to college next week, I've got 2 more to follow. And then it's like the reality of, will I be here for that? And the importance of being here. And there is a lot of hope, for sure. And there's so many things that are, so much has changed even since I was diagnosed, like, that nobody even really would even consider doing surgery on a stage 4 lung cancer patient. We had to push to get radiation to my primary tumor. And now it's like radiation is kind of standard. And I mean, what they're doing in MD Anderson with the surgeries, the lobectomies and the wedges on stage 4, it's kind of like really amazing. So there are a lot of good things. Do you have any examples or know of any ways that your diagnosis has changed the lives of your kids? Like the way they're not their personality so much, but, like their attitude towards others, attitude towards life. Have you seen any of that?
So my oldest is now 13. So my 3 oldest are boys. So I've got a 13-year-old boy now, a 10-year-old boy, and an 8-year-old boy, and then a 4-year-old daughter. I would say my 13-year-old is a boy. So this is like a very awkward stage, but I think he's always had a very tender heart. And I think he, as far as me, in the beginning, he just would always be worried anytime, like if I had a cough, a sneeze, are you sick? Are you sick? Are you okay? And I think that we've gotten past that point that he, we don't talk a lot about it. I remember in the beginning, I will tell you this, thinking back real quick, when we told him with like a child life specialist at our hospital I was being treated at in Dallas, and he was very adamant that he did not want to know where it was in my body, because for some reason that really bothered him to think about it being a real thing. But I will tell you that I don't know what calendar he saw because he's not on social media, but he knew that it was World Lung Cancer um, Day a few weeks or week or so ago. And, he just kind of said something to me. He's a man of few words. My 10-year-old he's a whole other story. He's like my true middle child. My 8-year-old boy, extremely sweet. We pray a lot before dinner, and he has, since I've been diagnosed and also with his class at school, continues to pray for mom's cancer, mom's cancer. And the other day actually asked me, Mom, do you still have cancer? And we talked about it, and he's like, you look good. And we did have a lot of help in the beginning. I will say that all of my kids, even my 2-year-old, we did a lot of sessions with our child life specialty group at our hospital that kind of, and also told Josh and I what to expect, because we didn't know, like, do you sit them and tell them everything? And then, we've also worked with different specialists saying, we're going to tell them the big things that need to be discussed, but it's too much, in our opinions, for their hearts and their minds to walk down every single session and treatment and appointment and things like that. And so we decided that we talk about the big things if we need to talk about it. And then we just pray every day for, God's healing, and that, my cells get turned to good, and that, that next doctor scientist group is able to produce these life-saving treatments.
Right. So could you tell me a little bit about how it feels to be the patient now and not the caregiver, as I know you're a nurse practitioner?
Yes. So I try to pretend that I'm like the best patient in the entire world. And there are some things that I'm very patient at. I don't ever complain about wait times. I don't ever complain. I just had an MRI last week, 4 IV sticks. I am like your go-to girl. I don't get upset. I know everyone has to learn. So in that aspect, I've been very laid back. But then when I think about, like, I can get overwhelmed thinking about like pathways and how this is going to work, and trying to actually diagnose or make these answers for myself. And that's been challenging because this is so far out of my realm of what I know, what I practice, what I do. And so I've had to really have good relationships and connections with the teams that take care of me, because I think I've realized for the first time how much trust is involved when you have someone taking care of you that's literally saving your life. And I think I've had to take a step back sometimes and let them do their job, and I've been told nicely, instead of trying to figure out every single thing and wanting every single thing looked at right now. And understanding that there doesn't always have to be something wrong. And that's a great thing. That's a great thing. Like, I have to stop looking at lab work and trying to watch every trend of, whatever, like my CBC or whatever, and understanding that they see the overall picture. And that I just need to take care of myself and advocate and let them do what they're good at doing.
Yes, I could imagine would be very hard.
Yes.
Also, when we think about this journey, I mean, none of it's easy. It's never really easy. And, we want it to be a long journey, obviously. And, I think both of us are kind of like guinea pig-ish. Like, they didn't really expect lung cancer patients to live as long as we're living. And
Right.
we're kind of changing the face and like the way lung cancer is being treated, all those kind of things. But if there's one piece of advice that you could give to people who are being diagnosed now, today, that you would have felt was beneficial to you when you were diagnosed, what would that be?
Um, that it's not a straight line, that there's going to be a lot of ups, downs, detours, and that it is not a death sentence the day you get that diagnosis. That even though we are part of this mutation group, there's so many variables. Your story is not anybody else's story. Your journey is not going to be like anybody else's journey. And when you read the great things and the devastating things, learning to see the person behind it and not trying to pick apart how they're like you, how they're different from you, what you could have done different. And I think just kind of understanding that it's not just going to be a streamlined process, that, you know, you're going to have really good days and really good results. And that if you get that progression call that something showed up on your scan, there's still hope. There's still things you can do. And finding the number one thing I would say is you find the best team for you. You know, it may involve a little research or reaching out to people with similar stories, but finding those centers that have treated patients like you, that have experience with treatments, that are up to date, that know the latest, and are doing, you know, the most recommended up-to-date treatments.
Exactly. Can you answer this for me? What is something that has been surprising, aside from the, you know, that it's never a straight path, but personally surprising to you in this journey, like with something inside yourself or with other people? Has there been anything, you know, I had experiences where I have a wonderful support system here, but there were certain people that as soon as they heard I had stage 4 cancer, they were like, we're out, you know, like the people I thought would show up didn't show up. And then people I didn't even think would show up showed up. So has there been anything that you've experienced that you were shocked by, I guess?
I have a similar, you know, I've had that same experience. There were people who showed up that I was shocked by. There were people who I think that I considered myself closest to, who I guess just could not grasp the reality of what this meant or what it means. And then I think the people that did show up, had a lot of them had been in my life for a long time. And I don't think it was by coincidence that they were here now and help point me to some like truths about myself that maybe I didn't quite realize or hadn't seen. And, you know, I am a mom of 4. I've worked hard. I work in the medical field, but I'm strong. You know, my body has done great things. I delivered 4 healthy babies. I've overcome a lot of like personal and mental and spiritual obstacles in my life. And I've got the grit to do this. And, you know, a really dear friend of mine said, you know, Karly, if anyone can do this, it's you. And I just took some time to see that about myself and not be afraid of that. Like, I can do this. I've got grit. I'll do whatever it takes. You know, I can be tired. I can go to any doctor's appointment. I can go see any specialist. I can, you know, do things that are good for my body. I can change my diet to give me more, you know, hydration and nourishment, and I can work out more. I've got the grit to do it. And I've got 4 wonderful reasons that I'll do whatever it takes.
That's awesome. I kind of feel the same way. You know, something that we hear a lot about now is different modalities, you know, things that are not standard course of treatment. And I'm not talking like, you know, crazy herbs or anything like that. I'm just talking about other modalities that are not traditional cancer treatments. For me, I go see a Reiki therapist and I do therapeutic massage and, you know, I try to focus on my diet and I try to exercise. So are there any other modalities that you have tried that you feel like are helping you either feel better, deal with side effects, or live longer?
I think the number one thing I do that has been most helpful for me is as soon as not too long after I got home, after I was diagnosed, I started journaling, and I still journal to this day. And it's been so good for me. Sometimes I'm able to write out my thoughts. A lot of times I write out my prayers, my fears. But it's been so wonderful because now, we're over 2 years into this, and I can look back and read over that and see all the fears and all the prayers that God answered for me, and see how that has been such a strong support for me. Two, I exercised before, and this is the thing I always tell people is Josh laughs about those 5 days I was in the hospital, because he said, if you told one person, you told everybody about how you ride your Peloton. And that's was true, because when they're like, have you had a cough or short of breath? I'm like, I ride my Peloton every day. I just hit 300 rides. He said, you told everybody. Because I have like just a natural, like pretty low heart rate. And then my not heart rate, blood pressure, but my heart rate was really low in the hospital. Come to find out it was because it's steroid. But I was like, well, I ride a Peloton. But that being said, that exercising, I think it clears my mind. It reminds me that my body is strong, that this thing inside me that I don't want does not affect what this body can do. And I'm going to appreciate and cherish what I'm capable of in these moments. And I'm going to push myself a little bit. And I probably today at 44 am the strongest and most in shape I've ever been in my entire life. And food wise, I've bought so many books about eat for your blood type, how to cure cancer, no sugar. And here's the deal. I avoid things that I personally don't want. So I try to avoid like added sugar. This is a big one. I stopped drinking alcohol. And I did that for a couple of reasons. One, for mental clarity. And two, I need to be nice to my liver, because I'm going to ask a lot about of her, to all these drugs. So I'm going to take that off the table. And I don't eat red meats, but I never really liked them to begin with. So that wasn't too hard for me.
Yeah. It's interesting, everybody always like asks, how you deal with this, or, I exercise regularly. I was a runner prior to diagnosis, which I kind of had to stop because of my breathing and also my bone mets in my spine. They were afraid that I was going to fracture bones, which it was, in hindsight, that was a good thing to hang that up. I switched to, like F45. I don't know if you all have those or not, but it's just
Yeah.
like circuit training or whatnot. And people will say, like, I is so crazy about it is that 2 days after I got out of the hospital for that diagnosis, I was back at F45. I was there the day they did the CT that I got admitted for. Like, and when I had radiation, I did it in Nashville because I go to Vanderbilt. But as soon as we were back, I was back at F45. And people are like, you're so inspirational. I can't believe you're doing this. Like, and I keep thinking to myself, like, this is something I can control. This whole
Right.
situation is so out of my control. So what can I control? I can control being in the best possible shape that I can be in, so that if and when it comes a time that I have to take some kind of treatment that's really harsh on my body, that I have the best chance at it being successful and me staying in a healthy situation. And then people are like, oh, I never really thought of it that way. But like you said, being in the best shape of your life, I feel that's where I am, like today, which is like the craziest thing ever, since I do have stage 4 lung cancer and I have had radiation to my lung and, whatnot. And I do take treatment every day. But I still get out there and get to it. And, honestly, my biggest motivation for that is not only to be strong and, mentally for me, my day is not good if I don't start it with some kind of movement, but is also because I have to believe that all that we're doing, the exercising, the journaling to get those emotions out, is just part of getting this medicine to respond as best as possible. And it's for my kids. It all comes back to the kids. And I also think by doing this, we're teaching everyone that sees us exercising, whether it's you're on the Peloton or whether it's I'm at the gym or somebody's walking or whatever they're doing, it does show other people that just because you have something unhealthy in your body doesn't mean you can just say, "Ugh, you know,
Right.
got lung cancer, can't exercise, so we are being role models for other patients and just for just regular old people that aren't necessarily taking as good of care as their bodies as they should. Um, are there any questions you have for me? Being that I'm I guess you're 2 years down the road and I'm 4.5 years down the road. So
So same question for you. If there was one thing that you could tell someone who's just starting this journey, what would that be?
I think for me, the biggest thing is my diagnosis, those 8 days in the hospital were so dark. Like you had said, I mean, so dark. There's parts of it I don't even remember. And I think that was just my body and brain working together just to block out the trauma. And I just think my message would be like, there is hope. They told me 6 to 12 months, then they told me 2 years, then they told me 5 years. Nobody can put a expiration date on your life because we're all different. Our genetics are different. The way we take care of our bodies are different. I feel like I decided then and there, I guess I should say, is when they said, well, only 5% of patients are living in 2 years. And I looked at my husband and my mom and I said, well, I mean, somebody's got to be part of that 5%. Might as well be me, so that's kind of been my slogan. Like, I'm going to be the 5%. And that's just how it's going to be. It's unacceptable to be anything else. So I think a lot of dealing with us on a daily basis and living fully and as long as possible has to do with attitude. Your mind and your body have to work together. And if my physical body was in great shape, but my mental health or my emotional health were not okay, I don't think I'd see as good of results or be here. So I think it's really just taking control in some way of your diagnosis, because we don't necessarily have control over when we progress, if we progress, that kind of thing. And the control comes in the things you do every day and having kind of the mindset of, okay, today's a new day. It's a gift and I'm going to use it as a gift, and thinking of something positive that happens every day, because there is a gift every day, whether it's that your coffee was just the right temperature, whether it was you got, accolades, from the Peloton or from a gym, or whether your dishwasher was empty when you went to load dishes from dinner. That's a win too. So I just think really trying to stay positive and I had a good friend tell me something one time that she has always felt like it's best to have someone ahead of you on this journey that you can look to for like inspiration, motivation, advice. It's someone to have that's at the same point in the journey to walk beside you and kind of journey through that together. And it's good to have people that were behind you as well, that have already gone through this, like that you're going, or not, I shouldn't say that are coming behind you in terms of like, they're going to be the next to be diagnosed, and what can you do for those people? So ahead, with, and behind, I think is a great way to look at it.
I love that. Yes. I think I'm just getting to the point, honestly, that I can think about those behind me. And it may sound a little selfish, but that's just, I feel like the first part, you're kind of in a fight or flight,
100%. And the
and
fight is real.
yeah, and it lasted for me, honestly, almost 6 months that I was just in this like numb, I'm so motivated. A lot of that again was the steroids. I'm gonna stay, on this course. And then I remember being about 6 months in, and I had so much hair falling out, like crazy amount of hair. And they did not believe that it was a side effect of Tagrisso. They didn't, I mean, that just wasn't one of like the amount of hair I was losing. So they sent me to dermatology, who did like a simple hair test. And I forget the name they diagnosed it with, but it's the result of a trauma.
Oh,
And they say it comes 4 to 6 months after a trauma. And they said the good thing is it'll stop, and the good thing is it'll grow back, but this is what happens. And they say it's similar to like some women lose a lot of hair after giving birth. It's just your body going through this major, and I had never, I had 4 kids, I've never lost hair. But it would just, and that to me was the first like physical sign of like, my gosh, I've been through something crazy.
Right.
And it is. And like you said, those days in the hospital, like I can't remember all of them. And literally when I think about them, and I know it was like summer and the sun was out, but when I think about those days, they're dark. Like the color of them is dark.
Mhm.
And it's just, and there's a lot I choose not to think about, but there's sometimes I go back and think about what that felt like. And
Mhm.
then but also how far I've come.
Yes.
So
And I think that's kind of how you have to do it. And I think really that goes along with that, someone ahead of you, someone with you, someone
yeah,
behind you, because if you didn't kind of approach it in that way, it's hard to maintain the hope. It's hard, it's hard to find your purpose. It's hard to think about those that come behind you, um, I think we're in a unique situation, in this day and age, you can connect with people all over the world. So, we're lucky that we can find support without it having to be someone, 15 minutes away from your home where you go to a support group.
right.
And, for all of us that are going through this is a trauma, 100%. There's no questions asked. But there are a lot of positive things that come out of it too, like your relationship with your husband possibly, or, meeting people like you and Lindy, through this journey. And, it's just a mindset, I think. It's total mindset. And, I know there'll be dark days for us ahead, more than likely at some point. But I think since we've already experienced those really dark days, we know the sun comes out after that. And I think that's a great thing too. I really want to thank you for talking with us today and sharing your experiences. I think that this will be beneficial to everyone just to hear another perspective, the patient, the caregiver. I think about my parents a lot of time and like what they're experiencing because of this. I think it's important that my parents see that other people are experiencing the same thing and they're doing well. I think it's good for my husband to hear these things. And eventually, when the time is right and my kids are old enough, it will be good for my kids. I always think about even kids of cancer patients who are in their 30s that are mature enough and, developed enough to think big picture, how this would be comforting to them when and if they had a parent diagnosed. So I really appreciate you being open and honest and sharing this part of yourself with us, because it takes bravery. It takes a while, because that darkness is so emotional. And there was a long time that I couldn't even talk about it. So I really appreciate you being here today and sharing this. I just can't thank you enough.
Well, thank y'all. I appreciate everything. And, it was the support I found from that first online group to talking to Lindy to connecting me with you that has helped me journey this far. So I'm very appreciative and happy to share.
Well, thank you.